shots in arms, we are making progress. In the last 2 weeks alone, nearly 7 million Americans have rolled up their sleeves and gotten their first shot. 7 million, that's the highest 2-week total since the beginning of June. And over the past month, we've also seen a 75% increase in the average daily number of 12 to 15-year-olds getting vaccinated, particularly important as adolescents begin going back to school. And once the numbers from today are reported, we will have reached 200 million Americans with at least their first shot. 200 million Americans with at least one shot. That's a major milestone. Americans across the country are continuing to step up, do their part, and get vaccinated. We are using every lever at our disposal to fight the virus, including by ensuring state and local leaders have the tools and the resources they need to get more shots in arms and to respond to any outbreaks caused by Delta. Our COVID-19 surge response teams are a whole of government effort with experts and personnel and resources from HHS, CDC, FEMA, the Department of Defense, and the Department of Veterans Affairs. These surge response teams are now working with 16 states to address their particular needs, from deploying hundreds of personnel to provide medical care, to standing up free testing sites, to surging critical assets like ventilators and ambulance to strained health systems, to getting shots in arms, including through the use of mobile clinics, to sending and supporting the use of life-saving treatments. And we will continue working closely with states to do all that we can and to match resources to their needs. Just yesterday, President Biden directed FEMA to continue fully reimbursing states, tribes, and territories for all eligible COVID-19 emergency response costs through the end of the calendar year, a 3-month extension of the order he signed on his first full day in office. Importantly, this maintains 100% federal reimbursement for state deployments of National Guard personnel for critical COVID-19 missions. President Biden committed to the American people that he would do everything in his power to end this pandemic. And from his first day in office, the president has marshaled a wartime effort to do exactly that. We've been preparing for every scenario, including the potential need for vaccine booster shots. Our approach on booster shots is simple, and it's consistent with our approach on every other front of this war. Be guided by the science and always, always stay one step ahead of the virus. Now let me turn it to Dr. Murphy to discuss our booster plans, and then Drs. Walensky and Fauci to discuss the science behind the plan. Over to you, Dr. Murphy.
Well, thanks, Jeff, and it's good to be with all of you again today. Today, I want to update you about where we are regarding boosters for fully vaccinated individuals. Our top priority has always been protecting people and their families from COVID-19. And we have been fortunate to have safe, effective vaccines that offer outstanding protection against the worst outcomes of this virus: severe disease, hospitalization, and death. The COVID-19 vaccines that are authorized in the United States have been remarkably effective, even against the widespread Delta variant. But we know that even highly effective vaccines become less effective over time. Our goal has been to determine when that time might come for the COVID-19 vaccines so we can make a plan to take proactive steps to extend and enhance the protection the vaccines are giving us. Having reviewed the most current data, it is now our clinical judgment that the time to lay out a plan for COVID-19 boosters is now.